In our summit rounds this morning, we talked about failed back syndrome. So what is that, and what should you know about failed back syndrome? I think there's a conception in the population that a lumbar fusion leads to all kinds of problems, and the patients that undergo lumbar fusions are destined to have additional issues in the future, adjacent segment problems, and that their life is never going to be the same. Failed back syndrome has a couple of different definitions, but one of the definitions that I think is most valuable is that the outcome of surgery does not match the preoperative expectation. That you undergo a lumbar fusion surgery and that your outcome is not what you had hoped it would be. What should be done if you're in a situation where you've had a low back surgery and your outcome is not what you had hoped it would be? Well, I think that this is an opportunity for the medical community to really put their minds together and come up with some solutions for you. First, we should look for specific causes for persistent symptoms. Is it a sacroiliac joint problem? Is the spinal fusion, did it not take, for example? Is the alignment correct? Is there persistent pressure on the nerves? Another thing that we need to look at is the fear and anxiety and the psychological aspects of it, because a lot of the outcome is based on the approach that the patient has and their interest in having the positive outlook going forward. We can look at medications, we can look at the nutrition, and we can look at the type of movement that you're doing, how active you are, what the muscle strength is, et cetera, et cetera. Spinal cord stimulation for some patients is absolutely appropriate and can give a significant benefit to patients. The take-home message, I think, for me from the rounds this morning is that for failed back syndrome or post-laminectomy syndrome, we want to think about this problem from an interdisciplinary approach. We want to think about it even before surgery, what can be done to prevent it in the first place. And then when we're dealing with patients that have persistent symptoms after surgery, we want to look at it holistically and as an entire team. And we hope that we can instill hope in patients who have ongoing symptoms, because there is hope. There's lots that can be done. There's lots of things that can be done to help improve the quality of life that patients have, even when they're in a situation that is challenging, such as failed back syndrome.